guys, welcome back, or welcome if this is your first time here. My name is Tamika, and I'm a board certified psychiatric mental health nurse practitioner. I also go by the name The Flagrant Psych MP, and on this channel, I provide mental health educational videos to help empower you to take control of your own mental health. And yes, today I am finally back from my holiday hiatus. I know it took a while, guys, but honestly, I needed every single bit of that time that I took over the holidays. And thank you so much for being patient with me as I work to bring you the first video of the new year. But how are y'all doing? I want to know how y'all are doing. Check in with me. Sound off. Let me know in the comments. Tell me, how was your holiday season? All right. I like to think that we all survived it, right? I'm going to be honest with you. Mine was just okay. I am so happy that the holidays are over. And, I don't want to sound like or come off as a Grinch, but I'm just happy to be back to some sense of normalcy. And, it's just exciting to kick off the new year. And it's not even that I have like any real traditional New Year's resolutions or anything, although I do need to get these nails done because they're still screaming deck the halls. But no, I'm just happy to have my house looking back normal again. With that being said, I have a couple of home improvement projects that I started last year that I'm excited to actually commit to finishing this year. I have a couple of new projects that I want to start, some personal goals that I'm excited about. But here's the honest part. Even with all of the excitement and the planning and the motivation and ideas swirling around, sometimes that can become a bit overwhelming, right? Especially trying to figure out what to do first, how to map everything out. And even just sitting with that, guys, I kind of had like a aha moment, right? Because I'm like, wait a minute. These are the exact same things that I'm hearing from my patients every day in clinical practice, right? And honestly, that's what inspired today's video. And it's going to be about adult ADHD. Now, let me be very clear. I'm not sitting here diagnosing myself on YouTube today. That's not what's happening. And also, let me emphasize this. Just because you're experiencing all of those feelings that I mentioned, the overwhelm, not knowing what to do, all these ideas swirling around in your head, that also does not automatically mean that you have ADHD. But what is important and what I see so often in clinical practice is that many of these symptoms that I'm expressing to you are persistent, long-standing, and significantly impairing for a lot of people. And that's where ADHD comes into play. And it probably seems like ADHD has become like a real hot topic online, right? Where you have some people saying it's overdiagnosed. On this side, they're saying it's underdiagnosed. And then you have a group that's saying it's just misdiagnosed altogether. But yet here I am adding another ADHD conversation to the mix, right? I told you guys before, I actually work with adult patients across multiple platforms, evaluating and treating ADHD. So I do try to stay on top of the most clinical, recent clinical evidence, the research, and the real impact that ADHD has on everyday life. And I genuinely enjoy learning about this condition and sharing accurate information. So kind of think of me as your psych liaison, right? Helping you move past all of the myths and the headlines and actually showing you what the science says. Before we dive in, let me say this, okay? ADHD is complex and layered. So there's absolutely no way to cover everything in one video without overwhelming you, okay? So today's video is not exhaustive. This is part of a series instead, right? Where I'm going to be breaking down for you how ADHD shows up beyond childhood, how it overlaps with like everyday stress, and give you an idea of when it may become appropriate to seek a professional evaluation. And in today's video, I'm going to start by providing you with the modern definition of ADHD, meaning like what is it really? How do we define it, right? What is it? And then I'm going to contrast that to some of the misunderstandings about ADHD and tell you what it actually is not. So that being said, let's get into it. So it's not necessarily that ADHD has become more common, but what has definitely happened is, awareness access to information and recognition with the condition has actually increased, right? Data shows that about 6% of US Americans, and that's about 15.5 million people, have a diagnosis of ADHD. And more importantly, more than half of those people receive that diagnosis as adults, right? And so that could be validating, it can be confusing, it can be overwhelming. A lot of stuff, right? And let's just be honest, let's call a spade, right? Social media has played a huge part in increasing recognition to the condition. So, platforms like TikTok, Instagram, YouTube, they basically made it impossible to ignore ADHD. And so, people are seeing themselves in these stories and these symptoms, and that recognition is prompting life changing evaluations. But, and this is important, right? Not every this sounds like me moment requires an immediate diagnosis. Remember, I told you that, some of those ADHD symptoms that you can see, those overlap with everyday human experiences, especially during stress, burnout, or sleep deprivation. That said, though, even when people are, getting evaluations, which may be a tad bit too early, the conversations still matter because what's happening is, again, awareness is increasing. And that awareness opens doors that simply weren't being open about 10 years ago. And that's also important in our goal in helping to decrease the stigma surrounding mental illness. Okay, question for you. If I asked you right now today to tell me how would you define ADHD? What do you think it is? Take a minute. You can pause the video, say it out loud, put it in the comments, whatever floats your boat. In the meantime, I'm actually going to give you the modern definition of what ADHD is. After I do that, I'm going to follow up and contrast with what ADHD is not. Now, ADHD is short for attention deficit hyperactivity disorder. And in the past, and sometimes even today, because I still hear it as well, you will hear some people refer to it as ADD, and that stands for attention deficit disorder. But that term was largely phased out in the late 1980s, and it was done because our understanding of ADHD evolved, and we began to learn that ADHD is not just about attention, but it's about regulating attention, behavior, motivation, and emotions, right? And so today we use the term ADHD, and you're going to find that there are three presentations of the condition. The first presentation is called ADHD predominantly inattentive type. And the name is just as the subtype implies, right? Patients with inattentive type, you're going to find that they have a hard time staying focused. They get distracted very easily. They may misplace or lose things very often. They might be time blind. Organization is not their best asset, right? The second presentation that you're going to see is the hyperactive or impulsive type. Now, again, the name is as it applies, but hyperactive leans more towards being impulsive. So, patients with this presentation of ADHD, they are typically fidgety. They might have a hard time sitting still. They may talk excessively. They may have a hard time with waiting their turn in conversations. All of those things leads towards impulsivity. And then you have the third presentation, which is the combined type, and it's just a combination of the inattentive and the hyperactive impulsive type together. Now, this condition is a neurodevelopment disorder, which means that people who are diagnosed with ADHD, they're typically born this way. They are born with developmental differences in the structure and function of their brain, right? And now everybody gets distracted from time to time, but ADHD is more about persistent, significant impairment in their ability to function on a day to day basis across different settings, right? Let me give you an example what this might look like in real life. So think about a scenario where someone might say, I don't feel like doing the dishes or I don't want to do the dishes. That would be considered like normal procrastination versus someone who has ADHD who might say, I want to do the dishes, but my brain won't let me do it. Now, that is an example of executive dysfunction. And we'll talk in more detail about executive dysfunction and executive function in another video. But in short, this is the part of the brain that basically helps you to initiate tasks, to remember certain things, to help you not act on every impulse. And so for people who have ADHD, this part of the brain, it works differently. So while it may seem automatic to others, with the ADHD brain, it's going to take a lot more effort. Okay, so we've spent some time talking about what ADHD actually is. Now let's shift and talk about what ADHD is not. And then I also want to take this opportunity to address some common myths associated with the condition as well. So ADHD is not a lack of intelligence, okay? Intelligence actually has nothing to do with ADHD. There are a lot of people who are diagnosed with the condition who actually have average or even above average intelligence, and they're highly creative and highly capable. The challenge with ADHD isn't understanding information, it's about accessing it and organizing it consistently. But from the outside, it can look like a person with ADHD just isn't trying hard enough, or like they could do better if they cared more, right? But here's the thing, ADHD is not about laziness or a lack of character or bad character. Remember, I told you earlier in the video that ADHD is actually considered a neural development disorder. Again, that means that their brains are wired differently, not like someone who doesn't have ADHD, what we would consider neurotypical. Now, when I say neurotypical, that just means that the brain functions in a way that's typical. So, where attention, focus, emotion regulation, that's all happening as people would expect it to happen. But people with ADHD aren't neurotypical. They actually consider neurodivergent. And again, this just means the brain operates differently from the neurotypical brain, not better or worse, just different, right? And so, because of these differences, tasks that seem automatic for a lot of people, like starting projects, staying organized, managing impulses, or just regulating your emotions, that's going to be really hard to do for the ADHD brain, right? And, when it looks like these people are, isn't trying or making excuses, remember, it's really just the differences in how their brain works. Now, it is true that the signs and symptoms of ADHD are typically first noticed in childhood, and the target age is age 12, especially when we're referring to the DSM 5. And what that means is that by age 12, you would have noticed those signs and symptoms of ADHD showing up in your life across different settings, whether it's at school or at home. You would have noticed them, and they would have created some type of significant impairment or impact on your ability to function on a day-to-day basis. ADHD though doesn't like go away as you grow into adulthood. Remember, I told you it's a neurodevelopment disorder and it's lifelong. And so, with that being said, a lot of times it persists into adulthood. Now, the symptoms might look different. And for that very reason, a lot of times, a lot of adults are going underdiagnosed because they don't typically present with the classic bouncing off of the wall type of symptoms, right? And the society actually expects adults to have their lives together, but adults can still struggle with maintaining focus, um, paying attention, emotional regulation. They can still struggle with those things. And then also, the symptoms can look different across ages and genders. To give you an example, for women patients, they are actually underdiagnosed as well because their symptoms also can look different. You're going to see that women struggle more with like being overwhelmed or anxiety or being more emotionally sensitive. And then here's another raw but real fact as it relates to the Black community, especially Black males. You're going to find that they're being misdiagnosed with things like, disruptive or mood disorders like bipolar disorder. And that is directly related to like clinician biases and stereotypes and just not employing culturally appropriate assessments, and so it's leading to misdiagnosis. And research actually supports the fact that ADHD misdiagnosis is higher in Black communities compared to white communities. And a lot of people still think that parenting causes ADHD, like not disciplining your children enough or not raising them right causes ADHD, but it doesn't, right? Now, neurobiology and genetics do play a role because ADHD is highly heritable, meaning that it runs in families and even across generations. Now, studies show that 70 to 80% of the risk of, being diagnosed with ADHD stems from genetics. So, if you have a first degree relative like a parent, a sibling, or child that has ADHD, then that means that you are more likely to inherit the condition yourself. But also worth saying is just because, parenting doesn't cause ADHD, now that doesn't mean parenting doesn't matter at all, because it does. And what we find is that parents who provide, supportive environments can help someone manage ADHD symptoms a lot better. So, for example, providing consistent routines or clear expectations, this can help someone with ADHD stay on track and be much more organized. I think another huge myth or misconception about ADHD is that it is caused by, especially in today's technologically driven society, is that it's caused by smartphones, video games, or social media. Now, modern technology can definitely make attentional difficulties more noticeable, but they didn't cause them, right? So, ADHD existed long before any of these technological devices existed. And there are historical reports that support the fact that children were struggling with attention difficulties, hyperactivity, all of those things before TVs and video games even existed. Now, again, modern technology can definitely make distractions or symptoms feel worse. And because when you have ADHD, you definitely can struggle more when you're switching between apps and getting constant notifications or being in a noisy environment. I don't know how many times I've already mentioned this in today's video, but I'm going to mention it again because that's just how important this concept is, or this fact is. And that is that ADHD is a neurodevelopment disorder. Again, that means that people with this condition are born with a different brain structure, different wiring. And there's no snapping out of that, right? It is what it is. So it is a lifelong condition. Now, it is worth mentioning that the symptoms of ADHD can and do fluctuate over a person's lifetime. And so think back, I told you about those three different presentations of ADHD. Well, that being said, at one point in a person's life, they could present as primarily inattentive. At another point in their life, they could be primarily hyperactive or impulsive, or show up as more of the combined type. Consider this too: at some point in their lives they may not even meet diagnostic criteria for ADHD, but the different brain wiring is still there, therefore the condition is there, it never goes away. Now, there are things that we can do to help manage, or strategies like therapy, medication, that can help manage symptoms, but the bottom line is that these things are not a cure for ADHD. Okay, guys, that is it for today's video. It was a lot. I know. I warned you. I told you in the beginning that it was complex. And honestly, we've only scratched the surface in today's video. Okay. But if this video helped you understand ADHD a little bit better, or helped you feel a little less alone, go ahead and hit like for me, subscribe, and even share this video with someone else who might still think that ADHD is just an excuse. And remember to stay tuned for the next video in this series, where I will break down how we clinically diagnose ADHD. Until next time, thank you guys for joining. Take care of yourself. Bye.
Take a whole day to recognize sunshine. When you need someone, I will be by your side. Hold on. There is a light that shines. Yeah.